This video will show you how to use a breath actuated nebulizer. Breath actuated nebulizers are similar to jet nebulizers that you might use when you're in the hospital. Let's see what's in this bag. Nebulizer tubing, the nebulizer cup, and the mouthpiece. Let's look more closely at the nebulizer cup. This particular model can deliver medication in one of two modes, breath actuated mode or continuous mode. We can tell if the device is in the breath actuated mode because the green ball on the top of the nebulizer cup is in the up position and the arrows are pointed toward this dotted triangle. To change it to continuous flow, we would point the arrows toward this solid triangle, and then we would notice that the ball is in the down position. For this demonstration, we're going to demonstrate the breath actuated mode. So we're going to turn the arrows back toward the dotted triangle and make sure that the ball is in the up position. Next, we would assemble the mouthpiece. Taking a look at the mouthpiece, you will notice there is a green valve on the bottom side of the mouthpiece. As you assemble the mouthpiece into the nebulizer cup, make sure that the valve is facing down. Now you would assemble your nebulizer tubing by placing this end over this port on the bottom of the nebulizer cup, and the other end of the tubing will go onto the compressor. Now to put your medication in the cup, you will unscrew the top of the nebulizer cup and squeeze your medication into the nebulizer cup. You place the top of the cap by twisting it back on securely. And now you're ready to take your treatment. Turning your nebulizer on, and place your lips tightly around the mouthpiece of the nebulizer, making sure not to block this exhalation valve. Continue taking your breathing treatment until all the medication is gone. Then you will want to make sure that you clean your equipment thoroughly between each use. That is demonstrated in a separate video.